So, what is scabies? Scabies is a parasitic disease. It is a highly contagious sporadic skin condition, highly contagious. That means it can easily spread from the one person to another person by the close personal contact. So, it is a highly contagious disease and highly pruritic skin condition caused by the gravid female mite Sarcoptes scabiei var hominis. Gravid female mite Sarcoptes scabiei var hominis, which lives its entire life within the epidermis. Now, that means the mite is present within the stratum corneum of the epidermis. You know the layers of epidermis. It is present within the stratum corneum of the epidermis. So, what are the predisposing factors? That is the socio-economic status, that is the poverty with overcrowded condition and also the overcrowded inadequate personal hygiene, overcrowded condition, poverty, and particularly in the hostel, old age room. In this condition, you will see the scabies more. So, the scabies is more common in overcrowded condition, number one, and also the person with the poor personal hygiene, it can easily spread from the one person to another persons. Now, the mode of spread, how it spreads? As I have already told, it is a highly contagious disease. So, it spreads easily from the one person to another person by the close personal contact or via the sexual route or indirectly via the fomites. That means, indirectly it occurs via the clothing, contaminated clothing, bed sheets, linen, towels, etc. It also can occur. So, the disease is usually transmitted by the close personal contact or by the sexual route or indirectly via the fomites. Pathogenesis, how it occurs? Number one, the highly host specific 8-leg mite, usually the mite is oval shaped and it has the 4 pairs of leg. 8-leg Sarcoptes scabiei var hominis causes the human scabies. The entire 30 day of the life cycle is completed within the epidermis, and each day the female mite usually lays 3 eggs, and from the eggs it produces the larva, and larva to after 3 to 4 days it produces the nymph. From protonym, tritonym, and finally the adult mite is produced. The cycle usually takes the 10 to 12 days to complete it. This is the most important aspect, that is, it is the entire life cycle is completed within the epidermis. The number of the mite living in the host can vary greatly, but in the most of the cases there are 10 to 12 or 10 to 15 mites. In most of the cases, the normal scabies, there are 10 to 12 or 10 to 15 mites, which is most important thing, 10 to 15 mites. But in the patient with the crusted scabies may have the thousands of the mites. So, I will come later in crusted scabies, but most of the cases the number of the mites are usually few, 10 to 12 or 10 to 15. So, why there is so severe pruritus? Why there is so severe pruritus? This is because of the hypersensitivity phenomenon reaction. This is due to the hypersensitivity reaction of the scabies mite or its product, usually it produces the severe pruritus because of the hypersensitivity reaction. So, number of the mites can ask in the questions or number of the mites can ask in the examination, what are the number of the mites? There is 10 to 15 mites only in normal scabies. Now, the incubation period. Incubation period usually varies greatly before the symptom develops. It ranges from the days to months. In the first time infestation, the incubation period is approximately 2 to 6 weeks. But in the subsequent infestation, the incubation period is short, that is 24 to 48 hours. But in the first time infestation, the incubation period is usually the 24. First time infestation, it usually takes 2 to 6 weeks to develop. So, usually the life cycle. The adult might usually have the 4 pairs of leg, but larva you will get the 3 pairs of leg mostly. This is the life cycle of the scabies. The incubation period is already told, that it varies greatly from the days to month. First time infestation, it usually takes 2 to 6 weeks, but in subsequent infestation it is recognized within 24 to 48 hours. Now coming to the clinical features, how it presents, that means the signs and symptoms. The most important clinical feature is the pruritus, which is exacerbated at night. That means the nocturnal pruritus is the hallmark of the disease. And number 2 is as it is a highly contagious disease, so the history of the pruritus among the close personal contact or the family members. So 2 history is the most important. একটা হচ্ছে যে ইচিং কখন বেশি হয়, that is the nocturnal pruritus, মানে ইচিং exacerbated at night. Number 2 is the history of the pruritus among the close personal contact or family members. This is the most important to history. So generalized itching, which is most severe in the night, is the most common presentation, and pruritus among the household family members are very much common. Now the distribution. The lesions are usually pruritic papular lesions. What is papule? Can anybody say what is papule? বলেছে papule. What is macule? What is papule? Papule is basically an elevated skin lesion, size less than 5 millimeter or less than 0.5 centimeter. It is an elevated skin lesion. So the distribution of the lesions are usually the pruritic papular lesion mainly distributed over the waves of the fingers, the flexural aspect of the wrist, the back of elbow, the axilla, nipillareolar complex, around the umbilicus, lower abdomen, genitalia and buttock, produces an bilateral symmetrical pattern and imaginary circle known as circle of Hebra. This is the most important. So the distribution of the lesions is most important. The pruritic papular lesions mostly the distributed over the waves of the finger, flexural aspect of the wrist, back of elbow, axilla, nipillareolar complex, around umbilicus, lower abdomen, genitalia and buttock, and also in the thigh region. It is distributed in a bilateral symmetrical pattern and produces an imaginary circle known as circle of Hebra. In the penile and the scrotum lesions are more common in the male, and in the woman the areola, nipple and the vulval areas are affected. The most important thing is that with infant the lesion usually present over the entire cutaneous surface area including the palm, sole and the scalp. But in case of the infant, what is the age of the infant? Infant কাকে বলবো? Less than 1 year, below 1 year. In infantile scabies you will get the lesion in entire cutaneous surface, but remember in the adult patient the palm, sole, scalp and face are usually not involved. In the adult patient the palm, sole, face and scalp is usually not involved, but in infantile scabies you will get entire cutaneous surface area can be involved. So this is the very most important aspect. The infantile lesion usually present over the entire cutaneous surface area including the palm, sole and the scalp. The pathognomonic sign is usually a burrow. What is burrow? Burrow is a tortuous line which is present over the stratum corneum, in which the female mite excavates while laying eggs. So burrow is basically a linear fine tortuous line which is present over the stratum corneum, in which the female mite excavates while laying eggs. How to detect the burrow? Put a Indian ink or Jensen violet over the waves of the finger or flexural aspect of the wrist, and it is whipped with alcohol, and you will get the thread like burrow will retain the ink. In this way we can detecting the burrow, but most of the cases burrows are not found because of the severe excoriation. The burrow is also distorted. Now coming to the clinical variants. There are many clinical variants, but the most important thing you to remember is the two most important aspects, that is the nodular scabies and Norwegian scabies. This is the most two important aspects. So what is nodular scabies? Nodular scabies is a persistent pruritic nodule, chiefly distribution over the genitalia, may be found on the axillary region and the groin. So it is a solid persistent pruritic lesion or nodular lesion, roughly 5 to 8 millimeter in size, mainly distributed over the genitalia and also found in the armpits or axillary region. And now coming to the Norwegian scabies, also known as crusted scabies. What is Norwegian scabies? Norwegian scabies is mostly commonly found in the immunocompromised persons, or it can be found in the persons with the neurological disorders like Down syndrome, and it can be found other neurological person taking the long-term steroid therapy, adult T-cell leukemia, lymphoma, organ transplantation patient, lepromatous leprosy, that is Hansen's disease, and also found in the HIV positive cases. You will get the crusted lesion. That there is extensive crusting of the lesion, and in that cases the lesions are also found in the scalp, the crustings can be found, and nails are usually swollen, distorted, and the subungual debris can be found. And in that cases the number of the mites are 1,000, numerous mites are found, and as the immune status of the person is poor, person is immune compromised, so itching is very minimal. In the usual scabies the itching is the hallmark of the disease, but in the crusted scabies itching is very minimal or absent. but it is a highly contagious disease, highly infectious disease. It can easily spread from the one person to another person. So, it is the one of the important cause of the outbreaks of the scabies, particularly in the refugee camp and the old age homes. So, crusted scabies is mostly found in the immunocompromised person and the persons with neurological disease. This is a very important aspect. So, a widespread crusted lesion mainly involving the face and scalp also can be found in the immunocompromised person, the neurological disorder I already told, and in that cases you will get the crusted scabies. Now, coming to this is the pictures of the scabies. As webs of the fingers are involved, you will see the small papular lesion in the webs of the finger, itchy pruritic papular lesion. You will get one pustules also, that is secondarily infected. You will get the pustules also. There is a pruritic papular lesion mainly distributed over the webs of the fingers. There is a classical lesions of the scabies. Now, this is the involvement of the genitalia. As I have already told, in the male patient, you will get the lesion over the genitalia, that is the penis and scrotal region. In the female, the vulvar region on the nipple areola complex is also affected. The most important, you will get the nodular lesion in the genitalia of the male scabies. Now, the palmar involvement. The palm, as I have already told you, the entire cutaneous surface area can be involved in the infant. So, the palmar involvement, sole involvement or face or scalp can be found in the infantile scabies, but it is not found in the adult scabies. Adult scabies, as I have already told, the distribution is just like the webs of the fingers, the flexural aspect of the wrist, the back of elbow, axilla, around umbilicus and genitalia. Usually in adult scabies, the palm sole is not involved or scalp or face is not involved, but infantile scabies, the entire cutaneous surface area can be involved. So, the classical lesion of the infantile scabies, you will get the lesion involvement in the palm also. And this is the case of the crusted scabies. You will get extensive crusted lesion, that is the extensive crusted lesion is found over the finger, and also there is, you will see the involvement in the palm also, and also the other entire cutaneous the crusted lesion. You will see the crusted lesion, the nails are usually distorted, swollen, and the crusted lesions are found in the Norwegian scabies or crusted scabies or hyperkeratotic scabies. Now, coming to the diagnosis, how it is diagnosed? Mostly it is diagnosed by the history and clinical examination. The two most important things of the history is the pruritus, which is exacerbated at night. That means the nocturnal itching or nocturnal pruritus. Number two is the importance of the other family members, whether affected or not. That is the pruritus among the household members or the family members. These are two important aspects of the history, number one. And number two is that you have to check the patient, that is the distribution of the lesions. That means the webs of the finger, flexural aspect of the wrist, the elbow, axilla, the around umbilicus, lower abdomen, genitalia, buttock, whether the pruritic papular lesions are present or not. You may get the vesicles or you may get the pustules that is secondarily infected. In secondary infection, the patient will also complaining the pain. So, the lesion distribution of the lesions is also very much important aspect of the diagnosis. So, the distribution and the morphology, though I have already told the burrows are pathognomonic, but most of the cases burrows are not seen due to excoriation, burrows are usually destroyed. Nocturnal pruritus, contact cases, these are the most important things. Skin biopsy is hardly required. In most of the cases, it is diagnosed by clinically. Biopsy is hardly required. Usually, most of the cases, biopsy is not required. Biopsy is hardly required. Biopsy is not required. So, and the other microscopic study of the skin scraping for the mite's egg or scabella, that is fecal matter of the mite, can be found. If the microscopic study of the skin scraping can be seen for the detection of the mite's eggs or the scabella, but particularly in the difficult cases or if there is any diagnostic dilemma. But most of the cases, the skin biopsy usually not required. Most of the cases it is diagnosed by the history and clinical examination and classical distribution of the lesion. So, history and clinical examination is the most important aspect, and the distribution of the lesion we can diagnose the scabies. If you think, how will you diagnose it? For two most important history is the pruritus, when the pruritus is occurring, and number two is the whether it is present over the all family members are affected or the close household members are affected or not. And typical distribution of the lesions is the most important aspect. Except in the infantile scabies, the entire cutaneous surface area can be affected. This is the important aspect. Usually skin biopsy in the multiple section demonstrate the mice. Some books it is written, but usually biopsy is not required for the diagnosis of the scabies. Now, the treatment, how it is treated? It is mainly treated by the topical medicine, and most important topical medicine which is given for the treatment of the scabies is the 5% Permethrin cream. 5% Permethrin cream is considered to be the drug of choice. Please remember it. Permethrin cream 5% is the drug of choice. This is the important aspect. It acts by inhibiting the voltage gated sodium channel of the mite, thereby causes the neuroparalysis of the mite. But it usually doesn't harm to the human body, because the drugs usually absorb very less quantity in the human. It does not produce any harm to the human, and usually it causes the paralysis of the mite. So, it is one of the important drug of choice. How the Permethrin cream is applied? Permethrin cream is applied from the neck to toe over the entire cutaneous surface area overnight, and it should be kept for 10 to 12 hours, and the next morning it is washed off thoroughly with the soap and water during the bathing, and it is reapplied again after 7 days later. So, if any larvae or if any nymphs are present, it will be destroyed in the next application. So, the most important is how it is applied. So, permethrin cream is applied from the neck to toe in the entire cutaneous surface area, except in the infant where head to toe application is usually done, except in the infant where the head to toe application is done at the night and wash off 10 to 12 hours later in the next morning with proper bathing, and after that it usually second application is done after 1 week later. And in that cases, all the household members should be treated at the same time, whether pruritus present or not, and all the clothing, bedding, bed sheet, linen, towels should be washed properly with hot water. This is the most important aspect of the treatment, number 1. And number 2 is as I have already told, permethrin is a very safe medication. It is safe in the pregnancy, lactating mother and infant more than 2 months of age. So, permethrin is a very safe medicine. If you present, it is also very much safe in the pregnancy, lactating mother and infant more than 2 months of age. Adverse reaction is very rare. Usually, adverse reaction is not detected in the human. Mild stinging sensation can occur in the human. So, if you asked about the application, the permethrin cream is considered the drug of choice. Other topical medicine which are used for the treatment, you just remember the name, don't go details of the medication, just go through the name, just that means the linden or gamma benzoin hexachloride 1% lotion or cream, protamidone 10% lotion or cream, or precipitated sulfur ointment 5 to 10% petrolatum base. Just remember the name. তোমাদের স্ট্যান্ডার্ডে শুধু নামটা জিজ্ঞেস করতে পারে হয়তো, যদি ডিটেলস কিছু এদের জানা অতটা দরকার নেই, শুধু পারমেথ্রিন 5% ক্রিম এটা সম্পর্কে জিজ্ঞেস করবে, কিভাবে অ্যাপ্লাই করা হয়, মেকানিজম জিজ্ঞেস করতে পারে, কিন্তু বাকি টপিক্যাল মেডিসিনের নামগুলো জানতে পারলে যথেষ্ট, পার্সেন্টেজ মনে রাখতে পারলে খুবই ভালো। লিন্ডেন or gamma benzoin hexachloride 1% lotion or cream, but for the CNS toxicity it is contraindicated in the premature infant. So, linden can causes the seizure, so it is a CNS toxic medication. So, these medications are not used particularly, and potential toxicity, relatively poor efficacy and widespread resistance make the linden an inferior treatment of the choice. In case of permethrin, resistance still not developed, but in case of the linden, one of the most important aspects is the toxicity, that is CNS toxicity. Seizure has been reported, number 1, and number 2 is the resistance developed, and also it is a poor efficacy. So, the linden is very inferior choice compared to permethrin. Other drug which is used is the protamidone 10% lotion or cream applied overnight for the 3 to 5 consecutive days, and then it is washed off. Although it has an antipruritic effect, good antipruritic effect, but it can cause the irritant contact dermatitis. It can cause the eczematous reaction or irritant contact dermatitis. So, protamidone is a good antipruritic action, but due to the irritant contact dermatitis, it is still not used commonly. Other drug which is used in the precipitated sulfur ointment 5 to 10% petrolatum base. Sulfur is not usually found, it has to be prepared by the pharmacist, and it applied in the 3 consecutive days overnight, and after that it is washed off. Sulfur is messy, malodorous and usually irritating to the skin and staining the clothing. This is most important aspect. It stains the cloth also. So, sulfur is messy, malodorous, it stains the cloth. But the most important aspect is that it can be used in the pregnancy. It is still safe in the pregnancy also. It is safe in the pregnancy, but due to the better drug, we have the permethrin. So, permethrin is still considered the drug of choice, but the sulfur can be applied in the pregnancy also. Now, coming to the oral medication. What is oral drug which is used for the treatment of the scabies? Ivermectin. Oral drug which is used for the treatment of the scabies is the ivermectin. What other purpose ivermectin is used? So, ivermectin, it acts by blocking the transmission across the nerve sinuses that utilizes the glutamate or GABA. It causes the paralysis of the peripheral motor functions of the neuron. It causes the paralysis of the peripheral motor function of the neuron. So, it usually acts by blocking the peripheral synapses that utilizes the GABA or glutamate. So, ivermectin acts by blocking the transmission across the nerve sinuses that utilizes the glutamate or GABA. It causes the paralysis of the peripheral motor function of the insect. User dose. What dose the ivermectin is used? Ivermectin is used, dose terms are just correct, 200 microgram per kg body weight used on day 1, and it can be repeated at day 8 or day 14. That means 1 or 2 weeks later ivermectin can be given. Most important aspect, ivermectin can be used. So, most important aspect of the use of ivermectin is the crusted scabies or Norwegian scabies. In case of crusted scabies, the ivermectin is given along with topical medication. Along with topical permethrin, ivermectin is used, because in the crusted scabies, the nails are usually distorted, swollen, and usually the nails are heavily steamed with the mite, and in that cases, the topical medication will not penetrate the nail. In that case, oral medication is given along with topical medication. So, you have to give both permethrin and ivermectin at the same time in case of the crusted scabies. So, it is one of the important drug for the use in the crusted scabies. Ivermectin appeared to have a good safety margin, although neurotoxicity is possible. Ivermectin also produces the neurotoxicity, particularly in the premature infant, that is the children whose weight is below 15 kg or below less than 5 years of age. Ivermectin is usually not used because it has a high chance of causing the neurotoxicity. It can cross the blood-brain barrier if the blood-brain barrier is not properly matured in that age group. So, ivermectin can cause the neurotoxicity and seizure. So, ivermectin is usually though it has a good safety margin, but it is the potential to cause the neurotoxicity. It is avoided in the infant and small children less than 15 kg weight, and also it should not be used in the pregnancy and lactating mother. Ivermectin should not be also used in the pregnancy and the lactating mother. But one of the important aspects of the medicine, it is an oral drug, and just remember the dose, that is the 200 microgram per kg body weight on day 1, and it should be repeat on day 8 and day 4. In crusted type of scabies, it should be given along with the oral topical medication, that means the 5% permethrin cream. Other supportive treatment for the scabies. What are the other supportive measures? So, most important aspect, just you should remember the 5% permethrin cream is considered a drug of choice. How it is applied, this is most important aspect. And oral medication, particularly ivermectin, is effective for the treatment of the crusted or Norwegian scabies. The supportive treatments are what are supportive treatment, that is the patient has the extensive itching or pruritus. So, the antihistamines are usually required, that is levocetirizine, cetirizine or hydroxygens can be given to relieve the pruritus or itching. If the secondary bacterial infection is present, as there is severe itching, patient usually if the upper part of the epidermis, the upper layer of the epidermis is usually distorted, and there is a high chance of the secondary bacterial infection, particularly Staphylococcus aureus and Streptococcus pyogenes. So, there is a high chance of secondary bacterial infection only. So, if there is secondary bacterial infection is present, you will get the vesicles and pustule formation, and patient will complain the pain also, and in that case you have to give antibiotics along with the topical permethrin medication, along with antihistamines. You have to give the antibiotics. Most commonly used antibiotics which are used for the treatment of the secondary bacterial infections are usually first generation cephalosporin, that is cefalexin, cefataxin or amoxicillin clavulanic acid can be given. So, most important aspect is also the antihistamines for the relief of the pruritus, and also the antibiotic if secondary bacterial infection is present. And all the clothes, bed sheet, linen, towels should be washed properly with the hot water, and all the family members should be treated with simultaneously, whether pruritus present or not. All family members should be treated, number 1. And now the most important aspect is the complication of the scabies. Complication of the scabies. What are the complications? Number 1, as there is a pruritus and excoriation, due to huge excoriation, usually there is a skin barrier is disrupted, high chance of secondary bacterial infection as the barrier is disrupted. Most common infection which is found in the Staphylococcus aureus or Streptococcus pyogenes. So, there you will get the folliculitis, furunculosis, impetigo. This type of secondary bacterial infections are common. So, in that case you have to give antibiotics, and if secondary bacterial infection in neglected cases, or if not proper antibiotics given in time, the post-streptococcal glomerulonephritis can occur, and other complications are the eczematous reaction or dermatitis can occur. So, just remember the superadded secondary bacterial infections, post-streptococcal glomerulonephritis and dermatitis or eczematous reactions can occur as a complications. Thank you. So, these are the aspects. The most important aspect, you have given the scabies. If it is given short note, just remember the few important saline points. First of all, what is the causative agent? Causative agent is a parasitic infection caused by the gravid female mite Sarcoptes scabiei var hominis. Sarcoptes scabiei var hominis, number 1. Mode of transmission, it is transmitted by the close personal contact or by the fomites or by the sexual route. It is a highly contagious and pruritic skin condition. Number 2 is the clinical feature. Clinical feature, you have to remember the nocturnal pruritus, that is pruritus which is exacerbated at night, and number 2 is the history of the pruritus among the household members or the close family members, number 1. And the distribution of the lesion, as I have already told, in the adult scabies, most commonly distributions are found in the webs of the finger, flexural aspect of the wrist, the back of elbow, axilla, nipple areola complex, umbilicus, lower abdomen, genitalia, thigh and the buttock region, produces an imaginary circle known as circle of Hebra. But in infantile scabies, the entire cutaneous area, surface area can be involved, including the palm, soles, scalp and the face. But in adult scabies, the scalp, face and the palm sole is not involved. This is the most important aspect. The variants of the scabies, usually the nodular scabies or Norwegian scabies. Norwegian scabies are most commonly found in the immunocompromised person or the persons with the neurological disease, particularly Down syndrome, organ transplantation patient, person taking long-term oral steroid therapy, or lepromatous leprosis and HIV positive patient. You will get the crusted scabies. In the crusted scabies, the extensive crust are found over the scalp region and the nails are usually distorted, swollen, and you will get the thousands of mites. Number of the mites in the adult scabies are usually 10 to 12 or 10 to 15. It is due to the hypersensitivity reaction which causes the severe pruritus. এটা জিজ্ঞেস করে, ঠিক আছে তো, যে number of the mites are so small, but why it causes the severe pruritus? It is because of the delayed type of hypersensitivity reaction. But in the Norwegian scabies, you will get the thousands of mites. This is the most important aspect. And now the treatment purpose. If you will given the treatment, just write down the treatment in short. That is the topical medicine. 5% Permethrin cream is drug of choice, and oral drug only effective is the Ivermectin, particularly in case of the crusted scabies. And complications of the scabies, just remember, as there is extensive itching, so the skin barrier is disrupted. There is a high chance of secondary bacterial infection, and also neglected cases post-streptococcal glomerulonephritis and eczematous reactions can occur. Just remember this point. The causative agent, number 2 is the clinical features, number of the mites, distribution of the lesions, and number 3 is the how it is diagnosed, mostly clinically, and types of the scabies, nodular scabies and crusted scabies, and medication, that is oral medication is mainly, topical medication is mainly used, that is the Permethrin 5% cream. Other than just you can remember the name, just remember the name, that is gamma benzene hexachloride, cotamidone 10% lotion or cream, or sulfur 5 to 10% petroleum base. Just remember that Permethrin 5% is considered to be the drug of choice, and oral medication which are helpful, that is the Ivermectin. And just remember the complications of the scabies. Just remember in this way.